Well, welcome back to Good Day. Certainly the hospital industry has faced a lot of scrutiny over its handling, in some cases admittedly mishandling of the Ebola situation. Steve Love is president of the DFW Hospital Council, which is basically the umbrella organization for hospitals in the Dallas-Fort Worth area. This has been a public relations nightmare. That if you could roll back the clock and start over, I'm sure you would, and I'm sure Presbyterian would.
Oh, absolutely. No question about it. And, you know, the hospitals, and we have 88 member hospitals, they feel the pain for Texas Health Resources. They're supportive. We don't look at this as a Texas Health Resource issue. We look at this as a North Texas issue. And we're all in this together. And we're going to work through it, and we're going to come through it, and we're going to absolutely be better prepared next time.
A lot of attention has been paid to the Centers for Disease Control Guidelines, which is this organization of scientists, basically, some physicians, some nurses in Atlanta. But as you pointed out, they don't actually treat anybody. They put things down on paper. They do go out on scene and get dressed up in the hazardous materials gear, but they don't actually treat people. That's something that happens right here.
Absolutely. Healthcare is delivered locally. And you've got to remember two things. The Centers for Disease Control has very talented people. They absolutely are a great organization and resource, but they don't treat patients. We treat the patients here. Let me give you an example, though, of where it's worked well in the past. Right here in Dallas, West Nile virus. The CDC, the local health department, the county health people, the political leaders all work together. We had quite a few cases of West Nile. This year, we haven't had as many. It's because we've learned, we've worked, and cooperatively, we have put in place procedures that we think are going to be better. This was the first outbreak of Ebola in this country.
This is a vastly different disease. Somebody at CDC likened it to AIDS. That's very different disease because it's willful behavior that transmits that. This isn't necessarily willful behavior. This is not borne by a mosquito. This is a person-to-person transmission. And somebody walks into a hospital. I think now, in hindsight, anybody else walks into a hospital anywhere in the country and says, I've been to West Africa and I've got a fever, they would be handled very, very differently. Who dropped the ball and why? Who's going to take the blame in the final analysis for this mishandling?
Well, the thing is, I think once we get through this episode, once we get through this entire episode, there will be a complete review. And Texas Health Resources has integrity. They will be the first to be forthcoming to say, these are things that other hospitals can learn from what we've done. I think last night, if you read the statement that was released by their chief clinical officer, he said, we're sorry. We made some mistakes in the initial assessment of Mr. Duncan. He admitted that. He also said, in our rush to give as much information, we moved too quickly and we put out some inaccurate information.
When the nurses, though, were complaining we didn't have protective gear, should everything have been stopped down, put him in isolation, and everybody said, okay, let's take a breath and see how we're going to handle this situation? A lot of complaints about contamination, lack of gear, lack of training, protocols that were changing, CDC protocols were changing.
Right. You know, I've heard a lot of that, and I can't answer that question directly because obviously I wasn't on the treatment team. But once again, when we get through this episode, we need to go back and take it step by step, be very methodical. What was done, what wasn't done, was there a lack of training, was there not proper instructions and protocols? And if they were, then we say they were. And we learn from that and in a constructive manner, change it so in the future it doesn't happen. You know, one thing that's come out of this, and I know it's a positive in a sense, and it was tough at the time. You're right. Most hospitals in America now, if someone has got the symptoms of high fever and vomiting, they probably are going to say, have you traveled to Africa, and specifically, where did you travel? And that has been an outgrowth of what happened here.
How much is this hurting Presbyterian and the doctors and the medical practices and the nurses that work there? This is a major center for childbirth in the Dallas-Fort Worth area, and if my wife were pregnant, she would not be giving birth at that hospital.
Well, you know, a lot of people I know feel that way, but let me just tell you this. This hospital's been around since 1966. It's an excellent hospital. You mentioned labor and delivery, cardiovascular. They have a SANE unit, sexual assault nurse examiners, one of the best in the nation. This hospital has a good reputation. Yes, this one episode of care and this problem is not being minimized. It's very serious, but they will come back, and the community is going to be very fortunate to realize that they deliver quality health care.
Thanks very much for coming in. We appreciate it.
Thank you.
Got more to come here on Good Day.